Hi, I'm David Mines. Joining me today will be Dr. Ford Brewer, the medical director of the upcoming Health Summit. I know a lot of you have followed Dr. Brewer from his YouTube channel and been impressed with the information that he shares on defeating the biggest killer of Americans, cardiovascular disease. And as you know, his focus is not about treatment of heart disease. There's plenty of great cardiologists out there for that. You may already have one yourself. Dr. Brewer's passion is about finding the real root cause of why you have the disease and then doing something about it to get it under control. So now let's connect with Dr. Brewer.
Well, hi, Ford. Welcome to the webinar.
Hey, David. How are you?
I'm doing well. So is it true that you can actually, today with what we now understand, you can actually guarantee if someone would actually follow the protocol that you have, you can, for all practical purposes, guarantee they will never have an event, never have a heart attack or stroke? Are we really at that point in the science and the medicine?
David, yes, a lot of people would argue that that's just not totally realistic. And I did not come up with that. I offer that in terms of my practice. I got that from Brad and Amy a few years ago. They've been practicing that way for many years. And it tends to be a standard guarantee within the Bale-Donine community.
And that's what we have to, as the Bale-Donine protocol.
Correct.
A lot of people following that now around the country.
More and more. Again, Brad and Amy have been preaching that cardiovascular inflammation gospel for many, many years. It was first developed by a couple of very smart guys at Harvard. But Brad and Amy have been running around the country doing a lot of teaching of docs, other healthcare professionals. You and I met in a couple of those seminars. So the reality is, yes, if you start looking at cardiovascular inflammation, you really can prevent heart attack and stroke. Practitioners in that area tend to put their money where their mouth is from that perspective and say, look, if you do the stuff that we're recommending that you do, you won't have a heart attack or stroke.
And we're talking ever. That's a pretty amazing statement.
It is. It's amazing. But
I think a lot of people think it's inevitable, especially if it runs in your family. It's just a matter of time. But we've kind of changed our position on that now and say it's not inevitable if you're willing to follow some standards.
Well, that is, as I've mentioned to many of my YouTube channel viewers, that is my legacy goal, is to get that message out there that heart attacks and strokes are optional. We used to put that in some of our marketing literature as well. They are optional. And it's not easy. Nobody's saying that it's easy to prevent a heart attack and stroke, but it's a heck of a lot easier than having one and hoping to get treated back out into a normal state.
Exactly. Well, let's go over some of the basics, Ford. Let's begin with the basic question. What's the most common preventable cause of cardiovascular disease? The thing that leads to heart attack and strokes, the big killer of Americans. What's the most common preventable thing a person could do?
You keyed on something that we discussed a few minutes ago, David. That is the term preventable. I don't pretend to treat heart attacks after the fact. Although most of my patients actually have had one event before they came to me, one or more. My focus is preventing heart attacks and strokes. Again, it is clearly possible. Now, the next question you bring up is, well, what is the number one cause of preventable heart attacks and strokes? It's inflammation, cardiovascular inflammation. Now, then the next question would be, well, what is that and what causes it? Let's skip over what that is. Well, now we'll cover that quickly. Cardiovascular inflammation is where your body is attacking plaque in your artery wall. You're taking friendly fire. Your immune system is attacking the plaque in your artery wall. That's analogous to people that have inflammatory diseases like rheumatoid arthritis or lupus arthritis. Those are two diseases where their bodies are taking plaque from their immune system. It's attacking their joints. Inflammatory bowel diseases, same thing. The patient's body is attacking parts of their gut, creating inflammation in the gut. So there are psoriasis. It's a skin disease. That's usually where the patient's skin is taking friendly fire from the patient's immune system. The immune system is a wonderful thing. It works extremely well, but sometimes it makes mistakes, and sometimes it attacks parts of our body. That's what happens with cardiovascular inflammation. Our body's attacking that plaque that's in our artery wall.
So then the next natural question is, what's the cause of the inflammation?
That's a really good question. It's insulin resistance. What does that mean? It's also called prediabetes. It's early diabetes, type 2 diabetes. Type 1 diabetes causes this as well, but again, most of us don't ever have type 1 diabetes. The vast majority of us, if we live long enough, will end up with type 2 diabetes or insulin resistance.
And again, this is not a death sentence, especially if you're aware of it. You're implying that it can be controlled like all these other risk factors.
Correct. In fact, the vast majority of people with type 2 diabetes never progress to even needing insulin. A lot of people may end up taking metformin or pioglitazone, but again, those are drug solutions. By far, the most important treatment, the most important solution for insulin resistance is not drugs, it's lifestyle. There's been research which showed moderate to mild lifestyle improvements are 3 times more effective than any drug.
And I understand obesity is a leader in contributing to diabetes and prediabetes, insulin resistance. I think that's pretty well established as a risk factor. I guess my question would be for folks like me and you who are not obese and people watching who are not overweight, we get a pass on that insulin resistance deal. How would you respond to that?
Yeah, a lot of people think that. And a lot of people think that even people that are aware that we're having a type 2 diabetes epidemic or a prediabetes epidemic, metabolic or insulin resistance syndrome epidemic, they say, well, it's because we've got an obesity epidemic. Now, there's a yes and a no there. Obesity does increase your risk for insulin resistance. But again, look at you, look at me. We're not obese. And I don't know about you, but I can say I don't think many people would call me overweight either.
And yet you and I mean, we just might as well be honest, we're both victims of insulin resistance, right?
Exactly right. And so when you look at the numbers, David, it's population-wide. Yes, obesity is a risk factor for us as individuals, but aging is a bigger one.
So we've got insulin resistance, which is common as a characteristic of just surviving life, living. Our risk for it goes up. That increases our risk of inflammation, which is the fundamental issue that contributes to the biggest killer, cardiovascular disease.
Correct. So what a lot of people don't know is that having blood sugars of 160, 180, 200, and even above are damaging to the arteries. They cause nicks and cuts in the inner lining of the artery, what's called the endothelium or the intima lining. When you get those nicks or cuts or holes in that lining, then LDL, or the quote bad cholesterol, goes through those nicks and cuts and starts to lodge there in the artery wall. You get enough of that lodging there, and that's a plaque.
Well, in just a minute, we're going to go into the actual webinar where we're going to see some of your presentation and some of the other faculty members' presentations. So we want everybody watching this video to stay tuned for that. We're going to give them a lot of content and go dig deep into that. But give us your kind of perspective on the summit itself. You're a faculty member, you're the medical director. Tell us, I mean, I guess somebody could come see you as their physician, if they're willing to fly to your location. Kind kind of balance this out with that option versus kind of the deep dive that they'd get at the summit?
So a couple of points. So this is a good place to introduce this summit to my YouTube channel viewers. So about 18 months ago, was it that long ago that we had the first one, David?
Yes.
So David Meintz is a professional with a wonderful passion for getting rid of heart attack and stroke as a major cause of death, and he's set up several different types of meetings where people can learn how to prevent heart attack and stroke. We did one about 16, 18 months ago called the Healthy Dentist Summit. Now, we'll be showing the rest of this video will show a lot of clips from that summit. As you'll see in there, you really don't have to be a dentist to attend that. And in fact, I would consider, one of the things I suggested to David is that we should open that to other folks as well. Because again, the vast majority of this has to do with how to prevent your own heart attack and stroke. You get a complete evaluation, you get labs. The labs and imaging are included in the tuition for the summit. Now, a couple of other points. One is an issue about the price point. The price point is it's what, $4,400 on the website, David?
Right.
So that sounds expensive, but then let's go back and compare the price point for seeing me as a patient. For a few, 6 to 8 months, I have been closed. My practice has been closed to new patients. We have just recently opened it back up and are opening it slowly. It's about $1,000 to see me for 60 to 90 minutes. It involves getting labs, but you pay for your labs. And it involves setting up time when I can go over these with the patient, or with you as a patient. So that's, again, there's a lot of interest in doing that. How can that compare to $4,400 for this summit? Well, number one, as I said, the $4,400 includes the labs and the CIMT. The other thing is it's 3 days compared to 90 minutes, 60 to 90 minutes. So again, a very, very different type of interaction. Now, when you realize the fact that the way to prevent heart attack and stroke is more of a lifestyle issue, the most important part is lifestyle, then you begin to realize there's a lot of information that I have to learn as a patient. Anything from what is the dawn effect when we're measuring our blood sugar, to what types of physical training are best. And then you get into the whole issues of debates about plant-based versus animal products in your diet, paleo diets, intermittent fasting. All of these things, it's very difficult. It's impossible to learn all of that in a 1 to 1.5 hour session with me. So again, as you start looking at value proposition, there's a couple of ways to look at it, and I think that's maybe a helpful way to describe that value proposition for viewers of the channel. Plus, you're in Orlando, so you can take a few extra days and go see Mickey or whatever interests you in the Orlando area.
I would also point out that all of this is delineated specifically on the website, thehealthydentistsummit.com, and people will have that referenced several times during the webinar coming up in just a few moments. All of that is broken down in terms of what the value is, and it's just so much more than just myself and Ford, and you all will see that once you go to the healthydentistsummit.com website. I will also mention too, if you are a dentist, you get 10 CE credits for this event, but like Ford said, you don't have to be a dentist to get incredible value for this. Dentists get for not only personal but professional application, but those that are non-dental professionals can still save their life and the life of people they care about.
So David, maybe I could ask you a question. And I've asked you this before, and you've clarified for me. Why did you set it up for the dentists and not just everybody?
Well, simply because it seems like dentists, I've spoken to over 300 dental groups in my speaking career in 27 years. And dentists, believe it or not, I find are, in all due respect, more interested in the total patient than some physicians are, who tend to specialize in a certain area sometimes. And they've been very responsive to this. And they also realize that, just like the rest of us, they're vulnerable to the big killer. And they want to prevent that. And they also want to prevent it in their patients as well. And they've learned now that what goes on in oral health affects cardiovascular health. A lot of people may not even realize that the bacteria we find in the mouth end up somehow in the artery walls of the heart. There's a direct connection between dental health and total patient health.
So if I could add my views on that, yeah, there's some very clinical reasons behind that. As you pointed out, if you have inflammation of your gums, usually you're going to have inflammation of the arteries in your body, leading to heart attack and stroke risk. Now, doctors that see patients with diabetes, it's the science and the experience is crystal clear. If you have diabetes, you have inflammatory gums. But what is not known that well is this is a two-way relationship. It's not that just that diabetes causes inflammatory gums. It actually goes the other way. Now, there's been a lot of back and forth in the science literature on that specific item, but I think that's been pretty much put to rest over the past couple of years. So dentists get up every morning like the rest of us, and unless we're retired, they get up, take a shower, eat breakfast, and go to work, unless they're doing intermittent fasting and skipping breakfast. But they look in people's mouths all day long. And guess what? Over half of us have insulin resistance. Did you know that number, David?
I think you told me that. That's why I knew it.
There you go. Over half of us have insulin resistance. So if you're a dentist, over half of the mouths that you're working in have some potential for inflammation. You know that. You know that it's causing risk for heart attack and stroke. You do that all day, every day, and you get passionate about helping in that area. And that's why you see dentists. I mean, you and I have shared your experience. Dentists have been the guys that are passionate about this. Other folks tend to just not connect the dots because they're not looking in mouths all day long.
I will also point out that we're going to do quite a spectrum of testing on participants that come. And some of these tests take several weeks to process. So to make sure that all those results are available when you arrive at the summit, we need some lead time to get this all processed. We're going to be doing, of course, some blood testing, some genetic testing, and we will arrange that ahead of time so that your results are there when you come to the summit. So as an incentive for those of you who decide to come, Ford, I think you and I have agreed that we're going to offer your followers on YouTube a discount off the tuition. I'm glad to do that, and I think it's maybe might make the difference for some people on their decision on to attend or not. So those of you that are watching this webinar, you'll get all those details and the discount code and so forth at the end of the webinar. I will tell you that the webinar is about an hour and 15 minutes, so hopefully you can set some time aside to watch this, take it all in, maybe watch it a second time. There's a lot of information that Ford is sharing and those of us on the faculty, but it'll give you a great idea of the value that's there, and there's no charge for watching this one. So I'd encourage you to do that. Is there any other comments or points maybe before we start the webinar, Ford, that you'd like to make?
No, I've reviewed the webinar. I think it's you get a lot of detail on that on this webinar that of the type that you get on the channel. So those of you who are dialing in from the channel, please take a look.
Good. Okay then, Ford. Well, let's start with the webinar, shall we?
Sounds good. Thanks. Pardon the interruption. As Dave mentioned, the content from last year's webinar is about 120 minutes. The folks that edited that for David are professionals in terms of video editing. I'm not. So I'm trying to cut this to make it fit for a YouTube format. Hopefully this will work. And basically what you should plan to see is the content in the next YouTube video. Thanks.